If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Today on To Your Health, Alzheimer's disease. It's a diagnosis that evokes dread. Also known as senile dementia, it is an irreversible, progressive brain disorder that causes problems with memory, thinking, reasoning, and behavior, seemingly robbing victims of not only their past, but their present and future. More than 5 million Americans are living with Alzheimer's, and the numbers are rising. Today, we'll talk to the director of programs of the New York chapter of the Alzheimer's Association. We'll also meet a social worker and a son caring for his ailing mother. And we'll learn about the signs, symptoms, and treatment options for Alzheimer's patients, as well as the support available to them and their caregivers. Stay with us for this very important edition of To Your Health. Hi, I'm Portland Helmich. According to the Alzheimer's Association, over 5 million Americans are currently living with Alzheimer's disease. And as the number of aging Americans grows, that number is expected to climb to 16 million by 2050. While there's no cure, at least not yet, there are ways to manage and improve symptoms. Dr. Anafidelia Tavares is the director of programs at the Alzheimer's Association's New York City chapter, and she's here to shed some light and share some facts about what is, frankly, a pretty scary subject. Thanks so much for being here, Dr. Tavares.
Thank you so much for having me.
I think a lot of us have a sense of what Alzheimer's disease is, but how do professionals like you define it?
Instead of the professional definition, I'll give you, a lay definition, which is Alzheimer's disease is a progressive disease that affects memory, thinking, and behavior. It's a type of dementia. There are more than 100 types of dementia. Alzheimer's is the most common cause of dementia. And so people should know that there are some recognizable signs that can point to dementia, and that if they see those signs, they should get medical evaluation. So at the Alzheimer's Association, we have a campaign called Know the 10 Signs of Alzheimer's, and it's really to arm people in the community to recognize some of these signs and then to take action.
So what are they?
So some of the signs are changes in memory that affect daily activity. Another sign is difficulty finding words, difficulty in planning. There can be changes in mood or behavior, withdrawal from social activities, difficulty with visual images and planning. And I encourage people to check out our helpline, alz.org, where they can see those 10 symptoms. We also have education so that people can get more in-depth information, so that if they see this in their loved one, in their family member, they can reach out for help.
How do you know if some of those signs are signs of just dementia as opposed to Alzheimer's disease?
So as I said, there are many different types of dementia, and that's really up to a medical professional to take a full history.
So you need a diagnosis.
Exactly.
How is it diagnosed?
So after, somebody comes to the doctor and says, my family member, I've been noticing these changes, then the evaluation will be looking to rule out reversible causes, taking a full medical history, doing a neurological exam. Then there's additional blood test, imaging, et cetera, that can then piece the picture together. And then there's sometimes neurocognitive testing to find out what is actually going on.
Now, I know that anybody can get Alzheimer's disease, but it's more common among women, African Americans, and Latinos. Why is that?
So for women, we are not fully clear. One of the things that we see in women is that age is a powerful risk factor for Alzheimer's disease. We see that women live longer, and that might be part of it. Scientists are still trying to figure out what else might be at play, whether it's genetics or hormones. So the research is still out. In terms of African Americans and Latinos who are also diagnosed at higher rates, we think that part of it might be genetic, but in addition, the risks of African Americans having diabetes, high blood pressure, obesity might also explain the higher rates of Alzheimer's that we see. And so that's why at the association we have another campaign, which is 10 Ways to Love Your Brain. So even though we can't prevent Alzheimer's yet, We know certain things can be protective of your
Like
brain
what?
health.
Like what?
So exercise and a healthy diet, quitting smoking if you smoke, being socially engaged, and if you have depression, take care of it. In addition,
What about being mentally engaged, like doing crossword puzzles or learning a new language?
right, those are all things that exercise your brain that are great, and we know that that can prevent against cognitive decline. So those are all the things that we encourage, that really brain health is heart health, and there are things to do. And we have educational workshops to give people, concrete action steps into what the changes that they can make in their life to protect their health.
What are some of the options for treatment? Are there any?
So there are. So there are medical options that are, pills, and then there are also non-medical options that are supportive that are.
To just slow the progression.
Well, currently we don't have anything to slow the progression
You don't know.
or, treat the disease in a way that is disease modifying. The treatments that we have in terms of medications, like donezepil, modify and improve some behavioral symptoms, but they don't actually change the course of the disease. But they can be very helpful in mild to moderate Alzheimer's disease. And again, that's why we encourage early detection, because if you have early detection, you can get these medications when they're most helpful. And in addition, you can get supportive treatments like counseling, education on how to deal with behaviors. And that education is both for the person with dementia and their caregiver, their family member, their spouse. And those are incredibly effective for both the person with dementia and their caregiver. And in addition to those treatments, it's also important that people plan for the future. So make decisions about their legal and financial planning. They can have advanced directives. And so the person with dementia is able, and with this diagnosis, can then plan for the future and be a part of their care, and make decisions for a time when they might not be able to in the future.
It seems like this disease, maybe more than even some others, must have such a monumental impact on the loved ones of people who are suffering from Alzheimer's disease.
Absolutely. And, there's a huge toll on the caregiver when they're assisting, their loved one. And they do a lot in terms of daily tasks, and it can be very overwhelming. But I think the message is, once we get early detection, you can get supportive treatment. There are organizations like the Alzheimer's Association that are there to help. So we have programs, like I mentioned, our education. We have a helpline that's available 24 hours a day, 7 days a week. Caregivers and people can call to get information, to get referrals to services in their neighborhood. And, we have master's level social workers who can sit on the phone, understand what you're going through, provide support, but also concrete services, can sit with you and come up with an action plan. And that's a huge, boon to caregivers and family members and people who are worried. In addition, we do that in person. We can link people to support groups so they get social support, and so can be linked with other people who understand what they're going through. So that is so critical, both for the health of the person who has Alzheimer's, as well as for the health of the caregiver. And so that's a key message to people, that there is help out there. You just need to call and reach out. So we have our website, which is alz.org. And then we also have our helpline, which is 800-272-3900. And really any day of the time of the day or night, we can help. And then there are other organizations as well that we can link people to provide concrete
And the
services.
Alzheimer's Association also has a program, do they not, that helps link people to programs where they might be able to get into some kind of clinical trial?
Exactly.
Therapies
So
that might hope or offer some hope for a cure?
Absolutely. So we have a three-pronged approach at the association. We advocate for caregivers. We provide services to caregivers and people with Alzheimer's. And then we are also working on a cure. So we advocate for more research dollars at the federal level, and we've been incredibly successful in that. And we're also the largest nonprofit funder of Alzheimer's research. And so it's through that three-pronged approach. We're helping people who are dealing with a diagnosis now. We're advocating for more care, and we're working on a cure.
How far away do you think that cure might be?
Well, so one thing that we do know from other diseases is like HIV and cancer, who many years ago the situation was dire, that if we are all hands on deck, if we have the resources applied to science and research, that we will get life-saving treatment. So that's happened in cancer, that's happened in HIV. And so that's why our advocacy is really focused on more research dollars, because we know that if we have those research dollars, we will get to that saving cure. And, in 5 years, we've doubled the funding to NIH and the National Institutes of Health and Aging for Alzheimer's research. And we're on track to make it, 1.4 billion, with the thought that these Alzheimer's scientists and researchers have come together and said that we need $2 billion to get a cure or an effective treatment by 2025. So we're on track. We're trying to help families right now as they're dealing with a diagnosis, but also, putting all our focuses on getting a cure as well.
Oh, it's fascinating information and really important. Thank you so much for being here.
Thank you so much.
When we come back, we'll look at what caregivers need to know and the support and resources that are available to them. Stay with us. Welcome back. Alzheimer's disease affects more than just the patient. According to data from the Alzheimer's Association, in 2015, more than 15 million caregivers provided over 18 billion hours in unpaid care, valued at over $221 billion, and at great cost to themselves financially, health-wise, and time-wise, with sometimes far-reaching consequences. Licet Valois is a gerontologist and a licensed social worker with expertise in aging and dementia care. She's a consultant to the Weill Cornell Alzheimer's Prevention Clinic and a program manager for the New York chapter of the Alzheimer's Association. She works directly with caregivers to ensure that they get the care they need and deserve. Licet, thanks so much for being here.
Thank you, Portland. Thank you for giving us the opportunity to be here, sharing some valuable information about Alzheimer's disease.
This is such a scary disease, and it must be so difficult for caregivers to take care of someone who's kind of losing their faculties day by day. What are the most powerful challenges that caregivers of people with Alzheimer's face?
And I believe you just said it so clearly, just seeing the deterioration progressively of a loved one, where the individual is going to be there physically for you, but that cognitively and mentally is not the same person anymore.
They might not even remember you toward the end.
They might not even remember you towards the end. And that's actually how the disease works. People will be able to remember everything from many years back, but the present they don't remember. So they don't remember that they have been married for such and such a number of years. And this individual that they're facing right now is their husband or their wife after 40 or 50 years of marriage.
So what kind of an impact does that have on caregivers? What are some of the main challenges that they face?
What is, besides the fact that you live in the day-to-day with an individual that is unable to function the same way that they used to function, is the unpredictability of the disease. With Alzheimer's disease, every day is different. You never know what's going to happen. It's not only day to day, but it's within the same day, from the morning to the afternoon, from 1 minute to the next. Your loved one might not even recognize you. Your loved one might have a nice conversation with you, and 5 minutes later, he or she might just completely forget that they had that conversation.
Yeah.
They might not even recognize you, like I said before. So it is challenging for the caregiver to take care of their loved one and also taking care of themselves. You know how difficult it is. In the meantime, you're trying to take care of them, but also making sure that you're taking care of yourself. So this is a matter of self-care now, up to what extent I'm gonna be able to be there for my loved one when I'm also taking care of myself.
And what kind of advice would you give to people who are caregivers of loved ones with Alzheimer's when it comes to self-care? What kind of time do you think that they need to carve out for themselves to do what? They need to exercise, they need what?
Well, one of the number one things that we actually have within the Alzheimer's Association as a national organization providing services for caregivers is try to educate people about what it's like to be caregiver, what it's like to be there for someone that is experiencing some type of memory problems, and at the same time being able to take care of oneself. It is very difficult, as I said, to take care of your loved ones and taking care of yourself. And sometimes it's even more difficult to encourage or empower the caregiver to remove himself, to go and do all those things that he or she needs to do, to making sure that they get in their dentist appointment, to go and get their physical, their annual physical, removing themselves for the day-to-day reality, but they also can allow other people to come and play the role taking care of their loved ones. Caregivers, at some point, some caregivers might feel that they are the only ones able to provide the necessary care for their loved ones. So they will refuse at some point to allow other people to come in and play their role when it's not necessarily. You are allowed to take care of yourself. The more care you're taking care of yourself, the more you're going to be able to take care of your loved one. We don't want to run the risk that there's going to be, at the end of the day, 2 sick people. It's already troublesome to take care of your loved one. And if you don't do well for yourself, at the end of the day, it's going to be 2 people sick needing care. So you don't want to get to that point. Even if you have to stop and take good care of yourself, go ahead and do it. Then you're going to come back more re-energized to take care of your loved one. And that's actually one of the things, again, that we try to educate people within the Alzheimer's Association. You cannot give to others if you're not giving to yourself. Give to others what you are actually giving to yourself, which is quality care.
What kinds of resources, assistance, either financial, logistical, emotional, is there out there for caregivers?
Well, we are very lucky and actually very fortunate because in the last few years, there has been the availability of accessing so many more resources than in the past, because with the great numbers, with the numbers in Alzheimer's disease increasing, so there's also the opportunity for more funding to come in and create more services. People are advised to get education within their community, education within the Alzheimer's Association with the free workshops that we offer. People can access individual counseling to be dealing with a loved one deteriorating physically and mentally with Alzheimer's disease. We need the support. So support groups might work for some individuals, but also individual counseling, being able to talk to someone as to what is like my day-to-day reality as seeing my loved one deteriorating. On the contrary, there are so many other people who enjoy participating in a support group because it's not only the therapeutic environment, but also the availability to share with others, to socialize, to feel yourself identified with other individuals, to feel less lonely, which happens a lot of times.
That's so important. And what kind of a role do you think the church or a place of worship plays for people who are caregivers of loved ones with Alzheimer's?
Actually, a very critical one. Not only because it is through so many places of worship that we are able to go and educate the parishioners, but also because of what I was telling you before, the availability of socializing with others, taking the caregiver from that day-to-day, which can be overwhelming and stressful at times, being able to share with other people, spirituality, being able to re-energize yourself, to invigorate yourself in whatever it is that you believe, whatever the name of the religion that it is another space for you to go and relieve the stress at the day-to-day caring for someone with Alzheimer's.
So what I'm hearing you say is, don't go it alone.
Don't do it alone. Actually, there is help. And unfortunately, people do not know about the type of help and services available. You don't have to suffer with Alzheimer's disease by yourself. And when I'm saying suffering, the caregiver, because when you're dealing with Alzheimer's disease, it's not only the person who is having the diagnosis, who has been formally diagnosed, it's also the caregiver. The caregiver is the one who's going to go through the whole journey throughout the whole entire period of time.
And we're going to talk about that right after the break. You're sticking around, yes?
Yes, thank you.
Coming up next, we'll be joined by Eugenio Bedoya, who's going to share the lessons he's learned as a caregiver of his 87-year-old mother, who was diagnosed with Alzheimer's disease just a few years ago. We'll be right back. Today, we're talking about Alzheimer's disease. With us is social worker and gerontologist Licet Valois. And we're joined by Eugenio Bedoya, who lives in Queens, New York, where he cares for his 87-year-old mother who has Alzheimer's disease. Thanks so much for being here, Eugenio.
Thank you for inviting me.
So what were some of the initial symptoms with your mother that told you something's wrong here?
Well, she used to be a very proactive woman, and her memory started to decay. And not only the decay in her mind, but it's forgetting to do things and not doing things anymore. I mean, all forgetting. And also seeing things that were not there.
Really? Like in a hallucinogenic sort of way?
No, she was saying like the closet the closet door is open. Close it because at night I've seen cats in here.
Huh. And you've been caring for her for how long now?
Almost 12 years.
12 years.
Almost 12 years.
So that's a long time. So how has your life changed as a result of becoming her primary caretaker?
It's changed tremendously because she's the center of my universe. And sometimes I feel like I'm Superman because I'm doing everything for her. I'm getting educated about it. I learned a lot about it. And Licet is very instrumental about this. I didn't know there were so many benefits that in storage for you, and I never used them.
What kind of benefits are you talking about?
Insurance, the kind of insurance where the insurance provides you with home attendant, daycare centers, even something as simple as Pampers.
Now, do you take care of yourself? Do you make time to take care of yourself while you're also taking care of her?
Actually not.
That's very honest.
Actually not, because like I was saying, the center of my universe, her name is Fanny. So the center of my universe is Fanny.
Fanny is your mother's name?
Is her name, yes. So I'm still working, basically full-time working. And
then you go home and you work more.
Oh, yeah. And I have a friend who helps me a lot with her during the day sometimes, some days. And now with the help of the home attendant, which has been only 2 months. And it gives me some relief. But there's so much to be done. Her medications, we have to do shopping. We have to shop for we have to eat. And she eats and I eat, and I used to go to the gym. I used to go to the gym 3 or 4 times a week. And up until a couple of years ago, I was doing it because she wasn't so critical. But right now, when the home attendant leaves, my friend leaves, and I'm with her, I cannot just leave her in the house and go and take care of myself. I mean, going to the gym, I love the gym. I haven't gone to the movies in a long, long time.
Yeah.
I wait until they come on cable because, first of all, she doesn't speak English. And number 2, she cannot sit for a long time. Number 3, which is the worst part, she would like a translation of what's going on the screen. So that's not fun.
So how common is this situation? He's sitting here saying, I mean, he knows that self-care is important, but he's being very honest and saying, you know what? I don't really have the time to do it.
Actually, it's very common, Portland, and that's one of the things that we address when we're sitting in the care consultation session with the caregivers. And you cannot give to others what you're not giving to yourself, and that sense of self-neglect at times is reflected in a lot of people when we're sitting right there in the room, when they portray like they cannot do anything for themselves, that their life is also going down just progressively with their loved ones. But it's also so important to help them understand that it's not only about their loved one, but it's also about themselves because they're working as a team and they both have to be doing well.
So what's the most difficult part for you, do you think, of caring for her?
There's not just one thing. There's few. One of the things is to see a person who used to be someone, and it's not there anymore. She's my mom. There's a body. It's there, but my mom is gone. She's been gone. There's a lot of things that we used to do together. We cannot do any. I don't want to sound like mama's boy. There's nothing wrong with it. But the thing is, I used to take her places. We used to do things. We cannot do those things anymore. Because first of all, she's having great difficulty walking. And sometimes when she needs to go to the bathroom, she goes to the bathroom. You can be on the street.
Anywhere.
Anywhere.
Mm-hmm.
And, so that's one of the most difficult things. And also, my mom was a nurse. And to see that professional is not there anymore. She cannot relate to a lot of things. And she keeps repeating the same story and asking you the same questions, not remembering, not putting a name to a face.
Yeah.
I know this face, and I know this person. She's just familiar, but I don't remember her name. And she still remembers me. I have a brother and sister. She remembers her grandchildren, and us, and me. But the times when all of those things, when I put her to bed at night, is when I get peace.
I understand.
Hoping that nothing was going to happen in the middle of the night.
So if I'm someone, Licet, who has a parent who's just been diagnosed with Alzheimer's disease, and I'm just about to start becoming a caretaker, what kind of advice would you give me in a nutshell?
get as much education as possible. And education is not only through books or through the website, there's also seminars that are provided, for instance, by the Alzheimer's Association. We go to the 5 boroughs and we present at churches, at libraries, community centers. Give yourself the opportunity to learn more about the disease, develop a care plan, and get all the support that you can get, because there is help and it is for free in some places, but you have to look for it.
This sounds, Eugene, like such a difficult hand that you've been dealt. Is there any silver lining to this for you at all?
Yes, there is. There is. One of the biggest ones is the help, the understanding that I get from my congregation. Everybody knows my mom. They know what she's dealing with. They know what I'm dealing with. I bring her to church, and once I get into church, it's like they take over. I'm able to back up, and then even though when she doesn't remember the names or the sermon or anything like that, but she knows the Sundays, the day that she goes to church. And Sundays, many Sundays, because of that and because other people are suffering from the same situation, we get to educate people. We get to educate. That's why I bring conferences into the church.
So you've become kind of a leader.
I am. Actually, I can say I am. Yeah, I'm trying to make people aware. This disease has no language, has no gender, no nationality, but it affects us, all of us, in the same way. My church, my silver lining is my support group. And the beauty of this is they don't know that they don't know that they are, but they're helping.
It's so important not to feel like you're going it alone.
Exactly.
Definitely.
I want to thank you both so much for being here. Thank you.
I want to thank you for bringing us here.
So everyone, that's our show today. Remember, there is hope and there is help. Whether you have Alzheimer's or you're taking care of someone with disease, you don't have to face it alone. For more information on today's episode, check out our show page. Until next time, here is To Your Health.